Good morning, and thanks for attending. Today I'm joined by Dr. Carol Zimbalati, Public Health Physician, and Shannon Mantha, Executive Director of Clinical Services and Chief Nursing Officer, to give an update on our local COVID-19 situation. And Andrew McClellan, Director of COVID-19 Immunization Strategy, will provide an update on our vaccine rollout. Before we proceed, I would like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I'd also like to acknowledge the Métis historical presence in the region. As part of our commitment to the Truth and Reconciliation Commission of Canada's call to action, the health unit offers cultural competency training for staff to better inform our programs in working with our Indigenous partners. This week, thousands of children and youth have made a return to in-person learning at schools. We are wishing everyone a fun and safe return to school. I'm happy to announce that over the past 2 weeks, we have seen a new wave of uptake in first dose vaccinations. In the last 7 days, 900 people have received the first dose, the highest number recorded since the middle of July. As of this morning, those aged 18 to 29 continue to have the lowest vaccination rate for both first and second doses. However, this past week saw the highest number of first doses given to this age group since the beginning of July. That is very encouraging. We have also had great success with our new mobile vaccine clinic bus, with 413 doses administered to date. Of those, 92 doses have been administered to those aged 18 to 29, showing the effectiveness of this bus in reaching one of our target groups. In the past month, we have also achieved a new milestone, with individuals 60 years of age and older surpassing the COVID-19 vaccination target of 90% being fully vaccinated. In fact, 92% of individuals 60 years and older are fully vaccinated. This is great news for our district, and I continue to encourage eligible individuals to get vaccinated as soon as possible. Vaccination remains a safe and effective way to protect yourself against COVID-19. We are seeing an increase in cases locally, as well as provincially, and this aligns with what the Science Advisory Table had predicted for the fall. We continue to encourage everyone to assess the risk in all their activities, and not only to take into account where they are going, but who will be there and if these individuals are fully vaccinated. As kids have returned to school, we also have to think about how we can protect them by keeping cases low in our community. And with that, I'll pass it over to Dr. Zimbalati, who will provide us with more details.
Thank you, Dr. Chirico. In the last 7 days, we had 22 new cases, bringing our total case count to 707, with 502 in the Nipissing District and 205 in the District of Parry Sound. The health unit currently has 23 active cases. There are currently no active cases that have tested positive for a variant of concern. Some new cases are still awaiting further testing, however. Currently, there are no individuals in hospital due to COVID-19. Over the past 14 days, 62% of individuals who tested positive for COVID-19 and were eligible for the vaccine were not fully immunized. Furthermore, 7 cases were born in 2010 or later and are not yet able to be vaccinated. 38% of cases have been identified as breakthrough cases, meaning individuals who have tested positive for COVID-19 were considered fully vaccinated. We are also reporting that most of the spread is due to individuals being close contacts of positive cases, and we are seeing more community spread. It is important people remember that although vaccination does not protect you 100% against the virus, it can protect you against more severe symptoms. Being fully vaccinated decreases the risk of being infected with COVID-19 by over 85%. But fully vaccinated individuals are also about 96% less likely to be hospitalized and 98% less likely to be admitted to ICU. As Dr. Chirico said earlier, vaccination is safe and effective in protecting you and your loved ones against COVID-19 and continues to be one of the strongest measures we have against the COVID-19 pandemic. I'll now hand it back to Dr. Chirico.
Thanks, Dr. Zimbalati. And now we'll have Shannon Mantha.
Thanks, Dr. Chirico, and good morning, everyone. As Dr. Chirico mentioned, this week thousands of children across our district have returned to school. And the Health Unit continues to support schools and school boards as they navigate through these first few weeks of our new school year. We want to thank the school boards and community partners who have worked hard to prepare for the return to school. Your hard work and dedication to the health and safety measures and student well-being is commendable. We understand that students are really excited to see their friends and are very happy to return to in-person learning. Let's take this opportunity as parents and community members to remind children and youth about the importance of continuing to follow public health measures while they're at school and in the community. Public health measures like wearing a face covering, physically distancing from others, washing your hands often, coughing or sneezing into your sleeve, and getting vaccinated if you're eligible. Additionally, don't forget to make daily COVID-19 screening part of your morning routine. The daily screening tool is available online through our COVID-19 and schools webpage or at ontario.ca/school screening. And last but not least, the Health Unit continues to support the return to school by being available to answer any questions you have about COVID-19 for parents, guardians, or anybody else through our call center at 1-844-478-1400. And I'll pass it back to you, Dr. Chirico.
Thank you very much, Ms. Mantha. And we'll have Andrew McClellan give us an update on our vaccine rollout.
Thanks, Dr. Chirico, and good morning, everyone. As of yesterday at 3 p.m., we are now at 82% of residents 12 years of age and older who have received at least one dose of a COVID-19 vaccine, and 75% of residents 12 years of age and older who are fully vaccinated. Additionally, 74% of youth 12 to 17 years of age have received at least one dose of COVID vaccine, and 61% have received both doses. As of yesterday at 3 p.m., a total of 179,064 vaccines have been provided in our district. Dr. Chirico mentioned earlier, we have seen a recent increase in vaccine uptake amongst those aged 29 and younger. In the past 7 days, there has been a 128% increase in the first doses compared to the week prior, and there has been a 293% increase compared to the same week in August. We've also had great uptake for the vaccine in individuals 60 years of age and older, with vaccine rates as high as 94% in second doses for individuals 80 years of age and older. In order to help address rising concerns related to the Delta variant, the ministry has revised its immunization targets to 90% of all individuals receiving both their first and second dose of vaccine. In order for us to achieve this goal, an additional 9,120 individuals need to roll up their sleeve for their first dose, and 16,952 individuals need to receive a second dose. I believe we can do this. With the return to school this week, the Health Unit has worked with schools and school boards to offer in-school vaccination clinics for students. Our clinics will begin next week. These clinics are not open to the public. They are open for staff, students, and families of students, and they can contact their school for more information. Individuals wishing to receive their first or second dose of vaccine can attend one of our scheduled clinics, including our mobile clinics. No appointments are required, and clinics are being offered throughout the district. A complete schedule is available on our website. Our mobile clinics are being very well received in the district. On Tuesday, we hosted a mobile clinic in the parking lot of Walmart in North Bay, and we immunized 321 individuals. 177 of those individuals were first doses and 144 were second doses. We continue to offer several mobile clinics throughout the district on a weekly basis. Finally, we continue to offer workplace and community organizations and places of worship and other groups the option to request a COVID-19 vaccine clinic through our mobile clinic request form on our website. With that, I'll turn it back to Dr. Chirico.
Thank you very much, Andrea. That's all very encouraging. So as we have concluded our remarks, we'll start taking questions. You can put them in the left chat box, and if you can, please associate your name with it. And with that, I'll turn it over to Catherine to give us the questions. Thank you.
Good morning. Our first question is for Shannon from Chris Dawson at Bay Today. Is there a concern about rumors that schools may be used as polling stations? Is this safe?
Sure. Thanks, Chris, for the question. So if schools or any other larger venue are utilized for polling stations for the upcoming election, they'll need to ensure that they are following adequate public health measures and adhering to any provincial requirements. So this would include physical distancing, cleaning protocols, use of facial coverings indoors, adhering to maximum capacity sizes. So if venues, including schools, are able to do that safely, then they're free to do so.
Thank you. Our next question comes from Eric Thompson at the Tribune and will be for Shannon as well. Has the health unit made any recommendations on whether fans will be allowed at hockey games this winter?
Yeah, so to my awareness, we've not consulted on this at all. We would if we were be happy to consult on this, but we would recommend that if it's the battalion or any other hockey organization looking at spectators and fans, that they consult with provincial guidance. And then if they have any questions, they can definitely give us a call.
Thank you. Our next question comes from Clark at Kojiko News, and perhaps Shannon or Dr. Zimbalati would like to answer. What is the status of consultations between area school boards and the health unit concerning the commencement of high school sports?
Sure, I can take that. So the status of consultation is that we have been working with the school boards throughout the pandemic, and we did work quite a bit with them over the summer. And they've worked together on a plan for inter-school sports that follows ministry guidelines as a minimum standard. And as always, the health unit is supporting this process. At the present time, we do not have any plans to restrict sports and activities that align with current provincial guidance, although this could change if we start seeing more cases or outbreaks and increased community transmission. And any further questions regarding timelines for implementation of school sports or inter-school sports should be directed to the school board, as that is in their purview.
Thank you.
Would you add anything, Dr. Zimbalati, or?
No, Shannon, I think you covered it. Thank you.
The next question will be for Andrea from Eric at CTV News. Is the health unit planning mobile or pop-up clinics in schools for students 12 and up? If so, do students who want to get vaccinated need parental permission to get the vaccine?
Thank you for that question, Eric. Yes, we are planning clinics at our schools. They've been scheduled starting next week on Monday at schools throughout the district in collaboration with the school boards. The dates were selected and parents have been notified of the dates for the clinics. As far as consent goes, there is no age of consent in the province of Ontario. Anyone who is deemed to be capable of making a decision, understanding the risks and benefits, and understanding the consequences of receiving or not receiving a proposed treatment is able to provide their own consent. So our students will not require parental consent, but parents have been notified of the planned clinics and the dates of the clinics at the schools.
Thank you. Our next question is for Andrea and Dr. Chirico from Rich Coffin at My North Bay Now. To reach 90% double vaxxed, will we need to see vaccines approved for residents 12 and younger, or can we get there with the current 12 and up?
I can start with that one. The numbers that we've received, or that we have around the 9,000 plus for first doses and 16,000 for second doses, is for people aged 12 and up who are currently eligible. Those numbers would change if the 5 to 12-year-olds were, or 5 to 11-year-olds were also included in those numbers. And my personal opinion, no, we do not need to have that 5 to 12-year-old group included in the numbers for us to achieve that 90%. That just increases the number of individuals that have to be immunized in order to achieve that 90%.
Thank you. The next question comes from Eric Kashner at CTV News. City Councillor Bill Ribosh wants mandatory COVID vaccine for city staff. What is the health unit's stance on business and organizations implementing a workplace policy which includes mandatory vaccination? Dr. Zimbalati perhaps would like to answer this question.
Yes, thank you. That is a very good question and very topical right now, obviously. We are supportive at the health unit of businesses implementing a vaccine policy in their institutions, and we are actually working on a toolkit to assist businesses in doing so. So without comment, obviously every business is different and they will need to have some variations in their policies to meet the needs of their particular institutions. But in general terms, we are supportive of that, as we believe that it does protect both the workplace and the community in terms of reducing transmission of COVID-19.
Thank you. Our next question comes from PJ Wilson, and he's asking, there has been an increase in the number of cases over the past week. How concerning is this? Perhaps Shannon would like to start?
Sure, thanks for that. I'll start, and then if Dr. Zimbalati wants to add in. So definitely we have seen an increase in the number of cases. This isn't unexpected as we've entered into stage 3 and there's more venues open, there's more socializing occurring and people are in closer contact. So we did expect to see an increase in activity over the fall. We will continue to monitor the situation as we always do, and take additional measures if required. So I think this just really reiterates the continued drive to get every individual that's eligible vaccinated in our district, so we can decrease the risk of COVID-19 throughout the district and in the beyond across the province. So it's not surprising we're seeing new cases, especially in light of the Delta. Our best chance to combat that is to be vaccinated and continuing following all public health measures. And Dr. Zimbalati, if you have anything to add, or Dr. Chirico?
Yeah, I'd just like to add that it is so important that there's a lot that we can do in this fourth wave to prevent our healthcare system and public health system from being overwhelmed. And vaccination, and as well as following public health measures, we know that it keeps people out of hospital. We know that vaccinations will help prevent people from getting really, really sick and ending up in intensive care unit or dying. So that is really the goal, to get as many people vaccinated so that we can certainly reduce those risks in the community.
Thank you. This will be our last question, and it comes from PG Wilson again. For Shannon, local school boards have still not announced sports program. Are you concerned about resuming intramural and varsity sports?
So, I spoke a little bit to this earlier around the work that school boards in our district have done over the course of the summer to prepare for re-entry to school, as well as assessing inter-school sports, and the health unit's been supporting that process. And we don't have current plans to restrict any sports or activities right now. Are we concerned about those sports and activities happening? I would say that we completely recognize the importance of physical activity and connectivity with children and youth, and the benefit that sports and extracurricular activities play in the lives of children and youth and families. We'll also be trying to balance that with local case counts, community transmission, and activity in schools. So if we start seeing more cases in school-aged children, outbreaks and increased community transmission, we'll be assessing that and watching it very closely. And we may make some changes to our public health guidance.
Thank you. This was our last question. As usual, the press conference recording will be posted on our website later on today. Thank you everyone for joining. We'll see everyone next week.